My name's Neil. I care and look after my mother and have done since 2003 when she received a dual diagnosis of Alzheimer's with alcohol dependency and depression. Later, towards 2004, my mother was sectioned, which led to a stay in the Maudsley Hospital for 6 months. At the point of discharge later that year, in 2004, towards the autumn, was a pivotal point where my mother was either to be discharged to a secure nursing home or to the community on the basis of a full-time carer. We took the view that my mother should come home, and I took on the role as a full-time carer to my mother to help to deflect to a better outcome. A number of years later, physical health became an issue for my mother, sadly, in that in the beginning of 2012, my mother was admitted to King's extensively with issue of sepsis and indeed a number of other physical health issues. And but during that admission, which was a long one of 4 months, my mother latterly had a stroke on the ward. This proved to be another main pivotal point in my mother's life, the stroke rendering my mother physically immobile and in need of a full care package. I should sort of add at this point, I think, that over the last 6 years post-stroke, my mother's care plan has remained unchanged in that time, although my mother's actual situation has become all the more complicated with various health issues which ostensibly have all arisen as a consequence or subsequent to the stroke. Fortunately, in the last 6 months, though, we have had the added input now of the district nursing service, whereby they provide the morning medications for my mother. My mother receives medications 3 times daily. And in that respect, I provide the second and third medication giving during the day, as indeed I do the hydration and nutritional requirements of my mother, whereby I maintain and operate the nutrition, which is given by a PEG tube directly to, which is a nutritional system providing food directly to the stomach. And I maintain that on a daily basis, and in conjunction with the carers, insofar as I have to stop and start it for the caregiving visits, and also ensure that my mother meets her daily nutritional and hydration requirements. And just reflecting on thinking of the sharing of information quite specifically, over the last year or two, I've noticed that this has become more readily available. That's all to the good, for fairly self-evident reasons, and that's certainly been helpful, and it makes for a better and more fluid form of conversation between the different clinicians involved. But really arising from that, it's also become a thought of mine with regard to who are the authors and who are permitted to be the authors, contributing authors to the information on the system. Who reviews the input? Is there any form of cohesive oversight to it on an individual basis? I'm thinking here of the actual patients, insofar as that one would hope or expect in daily life that there is a coordinating clinician. In the same way, one would hope that there'd be some sort of coherent and formed understanding of the patient, as opposed to a series of fragmented inputs from virtually anonymous contributors. And who accesses that information, and how are they allowed to act on it? I could think of a few examples. In one sense, they're difficult to form, but quite specifically, I know that my mother is seen as a difficult patient that has I don't know where that comes from, whether it's is to do with a generic presumption regarding her actual diagnosis or opinion, I don't know, that she's seen as apparently difficult, non-compliant, that is often questioned. And just connecting with the thought, we have been through A&E 22 times with actual admissions, that this is a recurring theme that comes to me. That, and yet I see that as, in other words, an impediment potentially to my mother's coherent treatment for different issues. There are individual views, individual access to that, and that always seems to be different. But nonetheless, there's this core thing, my mother is difficult. And yet, factually, on her records, my mother has been seen and recorded as being compliant for relatively invasive procedures, CT scans, endoscopies, and indeed, as my mother's son and carer, I'm aware that there are actually views with regard to my disposition, my awareness to my mother's condition, insofar as that I know for a fact that on the records that it is been framed that I have difficulty in coming to terms with my mother's diagnosis of Alzheimer's. I'm sorry, this is not the case. I don't know who the author of that is. It's undoubtedly anonymous in some form, and I have never been party to any formal meeting where that could have been recorded and advanced to any records, but nonetheless it is there and lingers. So just to reiterate, my concern with regard to information sharing would be who are permitted to be the authors, the contributing authors to records, who reviews those records, or might there be anybody reviewing those records even, and who are allowed to view these notes, this body of information, patient information, and who's allowed to act on it. And thinking perhaps specifically with regard to care provision, social care provision, I would wonder what level of information is made available to care providers and to the carers from the agencies with regard to the level of detail they know with regard to the patient, my mother, and indeed whether any further added insight is shared with regard to the family members or those immediately surrounding the patient, the cared for, and whether any information at that level might be divulged